Good times and great music at 2NURFM 103.7 as we take a look at some of the things happening in the world of science. We do that with our Professor of Science from the University of Newcastle, John O'Connor, who is back from being on location the last couple of weeks. It looks like he's lost a kilo or two, a nice tan, and mate, he's ready for downtown Hunter Street today. John, welcome back. Appreciate you being here with us.
Thank you, Mark.
All right, today we'll take a look at getting into the world of surgery a little bit, into the world of the C word that people, hope that never affects them, but cancer is the word of the day, as is the F word, fluorescence. Good morning.
Mark, you can imagine if you're a surgeon, maybe, you're trying to remove a cancer. And the trouble with that is that you want to remove all the cancer because you don't want to leave any bits there to keep growing. So you want to get all of it, but also you don't want to get rid of healthy tissue.
It's the balance, isn't it?
That's right. And the trouble is, it's not easy to tell the difference sometimes between the cancer itself and the surrounding material, but also certainly the cancer-infected areas and the healthy tissues. So how do you tell that difference? So it's been a challenge, and there are various tricks that they use. But there's a new study which is being done by a School of Engineering at Dartmouth in the US and the University of Wisconsin-Madison, where they come up with a slightly different approach. Now, the thing about that about cancer is that it creates a really messy network of blood vessels and so forth, and it's not really very well fed with oxygen. So it tends to be oxygen poor. So what can you do with that? Well, they found a molecule that they can track, which identifies this issue, and they use fluorescence. Now, fluorescence is when you take one light source, shine it on something, and it comes back with a different colour. Now, people might have seen this either in a museum or on the internet where a mineral, they shine it with UV and it comes out with a beautiful green colour or a beautiful blue or a yellow. It shines with actually quite vivid colours. And that's fluorescence. So you're coming in with one wavelength and it's giving off light in another. Now, the difference between the healthy tissue and the cancer-infected tissue or cancer-invaded tissue is that this fluorescence light doesn't flash just as soon as you do it. It sort of fades away very quickly, but slightly different times between the cancerous tissue and the healthy. And fortunately, the cancerous tissue fades away more slowly. So what you do is you shine the light in, wait a moment, and the light from the healthy tissue fades away quickly, and then the delayed fluorescence, the fluorescence from the cancerous tissue, drops away more slowly. It's still quite weak, so they've got to play some tricks with it. They use cameras where they take two photos and they delay them and they take ratios and so forth. But what this does is it makes that area around the cancer, which has been penetrated behind the solid cancer, which has been penetrated by the cancerous tissue, it comes out as quite clearly delineated. So you can then use that to identify where you should be doing the cut.
And it sounds, John, that once they get the optics on this completely right, but it will work out great in those two areas of making sure nothing is missed, because it'll sort of shine up that in that different way, the cancerous tissue that is, but also not having to take as much or any of the tissue, the healthy tissue we actually want to leave behind.
And sometimes that healthy tissue is in a vital area. I mean, in terms of the brain, you certainly don't want to take away parts of the brain which are still okay. In other parts of the body, there may be some vital organ nearby, and you need to work out if that vital organ has been
compromised,
invaded,
shall we say?
compromised, or if it's still okay. So it's really important to make this delineation to the best benefit of the patient. Get all the material, but don't get too much of the material. This is a high-tech way of doing it, but of course a lot of medicine these days does require high-tech.
All right, John, we'll keep an eye on this, and we'll see what comes to light out of this. See what happened there. All right, mate, appreciate it. We'll catch you next time, all right?
Thank you very much.
Our Professor of Science from the University of Newcastle, John O'Connor at 2NURFM 103.7.
A broadcast service of the University of Newcastle.